You are listening to Breaking the Waves, Conversations about the Dutch Pandemic. My name is Matt Cornell, and this is an English language podcast that takes a critical look at Dutch coronavirus policy. My guest today is Chris Meyns. Chris Meyns is a researcher in history of science and philosophy, focusing on the history of data and information. They are part of the Engaging Vulnerability Project at Uppsala University in Sweden, studying vulnerabilities in information sharing networks. In 2021, they are publishing two books, Information and the History of Philosophy and the Philosopher's Library, Books That Shaped the World, written together with Adam Ferner. They have been in self-isolation in the Netherlands since the early days of the pandemic. My conversation with Chris Meyns was recorded on May 27th, 2021. So, Chris, you wrote a couple of interesting pieces on your Medium page. The one I want to ask you about first is about Fieldlab. And Fieldlab has been pretty controversial, I think. And who or what is Fieldlab?
That was actually for me the entry point in looking into this in the first place. The way this got started for me was in January of this year. I heard that this organization, which I at that point didn't know much about, Fieldlab events, Fieldlab Evenementen, got permission to organize these large-scale events. So it's like concerts, festivals, also sports events, with at least 100, a couple of hundred, but some of them many thousands of people. And I thought, how's that possible? Because given official regulations, events now, I think the maximum is 30 people that you could meet with at a time. How is it possible that they're allowed to organize these events if these are the official guidelines? And then it emerged that it was okay for this group to organize these events because it was meant to be research. And this is what got me looking into this organization of Fieldlab. And what I found from all of the documents that they posted online was that it's basically the events branch. Large-scale sports organizations where people from ID&T, like all kinds of groups who organize events, are collected under the heading of Fieldlab events. And there's also support from the government for this umbrella organization, Fieldlab events. And they're basically, Fieldlab events is a gathering of organizations in the events branch in the Netherlands.
Okay, so a lobby, effectively.
A lobby, yeah. Okay. They became a lobby group when they said, hey, we need to talk to people in The Hague, people in government, to convince them of taking certain measures which are favorable for the events sector.
Okay. Now, just a question about this, because one of the things that keeps coming up about this is that they started doing these events after vaccines had already been invented and started to roll out here in Europe. Why would they need to find out how to do large events safely when, at least in theory anyways, we're all going to be vaccinated by the summer?
Yeah. But here's where the timeline also matters. As far as I've been able to see from the publicly available documents, the initiative for the events organizations to get together under this umbrella of Fieldlab events already started way earlier in 2020. So the earliest talk I've seen was March or even June 2020, where they said we need to do something because, well, obviously, not being able to organize events for that sector is really, it's economically damaging. So at that point, we didn't have a vaccine. So, but the movement of this group, this organization getting together and talking to people in government, I think that happened from June, and I have heard the date of October for a first official meeting with government. There it was already set in motion that something like these events would start to get organized, even though there was still large community transmission. And even though at that point we didn't have vaccination. So I think what happened was they already set this in motion. And then over the months, it was just carried out further.
Is it also possible? Is it also possible that they're thinking, if there's an outbreak of a variant in the winter, or if there's another pandemic, we now have proof that large events could continue to go on with minimal protections? I
think that's what they would want.
Yeah.
But here it also comes back to the point that we mentioned earlier. What are these events actually? So there are definitely events. There are festivals, concert performances that are taking place. They say it's research. So they say we need to organize these events to get data and to get results, to draw conclusions about whether it's possible and whether it's safe. So whether it doesn't increase the spread of infection, to organize these large-scale events. But one thing I touched on also in the piece that I wrote is, if it's a lobby organization, then to what extent is the activity that they're doing under the heading of research, is it scientific, and is it trustworthy? And one of the reservations that I had is, even before the first event was carried out, they already said we need to organize these events to demonstrate to the government that it is okay to allow large-scale events to go ahead, even when there is high community transmission of the virus. And that gives an indication that they already said, even before any of the studies were carried out, or the events were active, that the conclusion has to be that it's safe to organize these events. So it seems like the conclusion was already fixed even before they did these studies. And if what you want to conclude is already basically fixed even before you carry out the study, to what extent is this actually a credible study? And
right. So sort of like oil companies wanting to find that there's no risk of carbon emissions and that kind
exactly. The drink industry wanted to demonstrate that there's no problem with high sugar levels, you should just exercise. Climate change deniers often use these so-called research studies to demonstrate that there's actually no problem with high emissions. So if the conclusion is already set, even before you do any of the study, then my thought is we need to be very suspicious of what comes out here. And actually, in case of Fieldlab, I would suggest that we can't use what they bring out as results as completely unusable. We just can't draw conclusions about that.
Now, there are scientists advising Fieldlab, I guess, or involved in these events.
Yeah.
Who is involved, and what exactly are they doing? How are they involved in the research?
So, as far as I've been able to determine from the documents, there is a shifting list of names of people associated with it, but the person they are most keen to put forward is a professor at Nijmegen University, Andreas Voss, who's also, surprisingly, or perhaps not, advising the government. So they're part of the outbreak management team, which advises the RIVM body.
Right. So just to emphasize this point, a scientific expert who's on the government's own outbreak management team is also supposedly overseeing these events lobby
absolutely
experiments. Okay.
Yes, and it's not just this person. There's another person who's both involved in the Fieldlab events and is also on the outbreak management team, Professor Marion Koopman. So they're at Rotterdam. So they are both names of people who have been mentioned by Fieldlab events as having some affiliation with their supposed research, and are also they're involved in making the activities of Fieldlab events. And they're also on the body that's meant to assess the documents that are produced by Fieldlab Evenement, or they're advising that body.
Which is great for them. Yeah, and as two people who have to do a lot of reading, you and
yes.
It sounds great to not have to read the documents twice, right? If you're already reading the documents for your lobbying work, then you don't have to read them again for your government.
Exactly. Yeah. So people have commented on this as marking your own homework. I think it's actually more, you're both setting your own homework, and then you're producing it, and then you're marking it. There's something dubious going on there.
Right, and you actually point out yet another problem here, which is not only are they marking their own homework and setting their own homework, this is the government effectively paying to lobby itself, right? Could you talk a little bit about that?
Yeah, so the body of this organization, Fieldlab Events, is officially composed of 3 parties. So 2 parties who are from the events branch, the event platform and the Alliantie van Evenementenbouwers. And 1 party is from the government, so that's ClickNL, and which is the channel through which the government can initiate public-private partnerships with the creative sector. So the government is through this this collaborative arrangement, channeling a bit more than 2.7 million to this entire enterprise. And then, as you said, it's basically, in that case, paying this organization. But this organization, as we've discussed, is a lobbying organization, which is going back to the government to say, hey, can you please change the regulations here so that we can have large-scale events again? So basically, the money goes to an organization and then back to, that information is meant to go back to the government.
So tell us how one of these events is set up. Like if someone goes to a Fieldlab event, what kinds of precautions are there? What happens at the event, and what happens after the event?
So what I understand is that this differs per type of event, and they have quite a number of different types of events. So some of them are open air, like a soccer match, and then some of them are indoor, like in a theatre performance, and there were also large-scale festivals. Most recently, we had the Eurovision Song Festival, which was an indoor event. And the whole premise of these events is that you get tested beforehand, and then once you're part of the official event activity, you can ignore COVID rules. Or basically, they said the premise of these activities is to let go of the official COVID regulation. So I believe there may have been instructions of what to do or where to behave or how to wash your hands or when to wear or not to wear a mask. But I think in general, people were free to, if they so chose, to not wear masks, to not keep social distance. So to, just party like there's not a pandemic going on.
My understanding of how it went with Eurovision in particular was that they were supposed to wear their mask when they got up from their seat to go to the bathroom or to the bar. But that they were encouraged to take their mask off, obviously for the cameras and while they were cheering. Also, although Fieldlab reduced the capacity, I've been to Rotterdam, Ahoy. I've been to that. And I know that 3,500 people isn't very much for that room, but because it was a television event, they had everyone squeezed together without masks, cheering, which, as we know, is a very high risk kind of way to produce a lot of aerosols.
Absolutely,
So indeed, it doesn't seem like there was much protection. I spoke to someone who went, there were 9 of those events, 3,500 people each. And I spoke to someone who went to one of those, and apparently the testing after the event is also optional. And
this has been a constant throughout all of their activities. And they said they made it optional because they couldn't force people to take tests. But then the thing is, if you run a study, then usually you would make it a component of such a study that there's also some sort of check at the end. Of course, you're not going to force people, but you can make it a fixed component. And here they're just encouraging people to get tested afterwards. But what I heard from earlier results that they brought out was that I think it was about a third of the people didn't get tested. 30%.
Yeah.
Or was it a third? Well, one of those. It was a high proportion of people who didn't get tested at all. So there was basically no check there was no fixed check to see whether the organization of the event had led to an increased spread of infection or not.
And in fact, I think Fieldlab came out just this week and said that they were not going to report the number of infections. Can you talk about that? That was concerning.
It's slightly baffling, but if you see it in the light of them being a lobby organization, it sort of starts to make sense. So the reason that they gave for saying we're not going to publish this result was then everybody will talk about the infections or the number of infections that have taken place at this event. And that's not them being a lobbying organization. That's not what they want to talk about. They just want to talk about how wonderful it is that there was Eurovision. But put it like this. If you get funded by the Dutch Nederlandse Wetenschappelijke Organisatie, the Dutch science body, there is no way you're going to get away with saying, well, we'll take these millions, but I'm not going to report on whatever findings I had. I think in that case, you just have to give it back. I don't know about the official regulations, but as a scientific study, that's just not how it works, that you just choose to publish or not to publish, depending on whether it's convenient.
There were reports on infections leading up to the end of the event. And I think there was a report of something like 17 infections, including last year's winning singer. Yeah. And although he was then in isolation and missed the rest of the event, people he was in contact with were still at the event, including one of the hosts. And we know that even if she tested negative after being in contact with them, she would need to wait at least 7 days, I think.
Absolutely.
So,
And the normal instruction would be, okay, if you've been in touch with someone who tested positive, then you isolate, at least for the period until you can check if you have it or not. And as I understand it, that wasn't followed here either.
Yeah. I was also a little horrified by some things that were not, they were discussed in the Dutch media, but when the international media got the Eurovision spirit, they kind of didn't mention these things. And a couple of them were that people 70 years and older were not allowed to attend the event, even if they had been fully vaccinated. And people over a certain weight, a certain BMI, fat people basically were not allowed to attend the event. So there was this kind of not widely discussed element of discrimination.
Absolutely.
And this is even if you had been vaccinated.
And this was indeed a factor that they had with all of these events. I think studies I read, it was even people over 55 that they didn't want to have as part of it. It's the whole setup was, again, was this a scientific study or was it just some sort of PR stunt? If this was treated as Eurovision normally, but then with precautions, this would have been incredibly exclusionary to say that if you belong to this group, that group, you can't come. If it's a scientific study, then you'd think, okay, you need to choose carefully. First of all, how many people you take into your study, and then make sure that the study, the population you're studying is composed in such a way that you can draw some inferences about this. So then completely different considerations come into play. Volunteers are sometimes paid to take part in a scientific study. They don't have to pay to take part in a study. And
people pay quite a bit to do some of these things, like, for instance, especially the ones that involve travel. than going to other countries. Well, this age discrimination thing also stood out to me because last summer, of course, when nightclubs were lobbying to reopen, nightclubs and bars, there was a proposal put forth by that industry, by I think over a dozen, maybe 24 nightclubs, that they should be allowed to reopen without masks or distancing, only for people under 40.
Yeah, this is just...
At the time, Rita, kind of scoffed at this, and everyone dismissed it as this kind of far-fetched thing. And I remember being a little chilled to see how many established nightclubs signed on for that, because I'm 48 now, and up until the pandemic started, I was running a cultural venue. Yeah. I was running a bar and nightclub that did live events, and I thought, this is a huge sign that this industry and perhaps this country doesn't envision me in it, in its cultural life. And so then this Eurovision comes along and says, too old, too fat, too vulnerable.
No, absolutely. Yeah. And this is a point where people making decisions about policy, it really demands a principled stance that this sort of exclusionary practices, it's just not acceptable. I mean, I would think it's not acceptable, because you're just preventing people from who are part of the people who live here from preventing them from taking part in public life.
Yeah.
And I think there are similar ethical questions about requiring a test for entry, if that test is something that people have to pay for, because then you're excluding whole groups in the population who don't have access to pay. I think, what do they charge, like €7, a tenner or something for each test? You can't, for who it's just not an option, if you want to have grab a cup of coffee, to pay an extra €7 for that cup of coffee. So there too, there are loads of issues here which require a principled stance of standing up for. I'm not sure whether it might actually be one of the human rights to participate in a cultural life. But we haven't seen that from the Dutch government.
It's a good point, because there are countries using access tests, using rapid tests for access. I know in Germany, for instance, where those are paid for by the government. And even furthermore, you don't have this situation where a private individual with no medical training is expected to stick a swab up their nose, right? In a lot of these places, it's still handled by someone who's been trained to do that kind of thing. And, right now they're going to have a whole fight about high school students and whether they are going to test themselves. And again, it seems quite strange to expect to sort of deputize someone as a nurse,
absolutely. And another huge question here is the role of private companies. So GGD, the municipal health authorities, they've been involved in testing, but so many of these access tests are run by private companies. So loads of different questions about what happens to that data, and do we want these private companies to run, to basically be the barrier for people to take part in public life.
It also seems bad for data because we already know that I know that it's going on now for sure, that Snell tests are available in any grocery store or drugstore, that we can't quite trust the infection numbers anymore because people don't have to go to a testing site. And I know that companies were using, like particularly employers were using private testing companies back in the summer and fall last year. So it was unclear how many of those numbers were actually getting to the GGD and to the RIVM.
Yeah, absolutely. So I think this is something that's also going on right now, that I almost wanted to say that the infection numbers are getting low, are quite low. They're not quite low. Like we're still having thousands of new infections a day. But as you say, indeed, so many people are just getting a test themselves rather than going to the GGD. And there's no obligation for people to report if they're tested positive. So we're missing we're definitely missing numbers.
Could you talk about why this is bad for science, and particularly why it's bad for data and information systems?
The basic answer is that if we're missing these numbers, then we have a less solid, less accurate picture of what is happening to the infection in this country. And that will in turn feed into decision-making policy. Policymakers are then basing their decisions on skewed, incomplete data. I mean, of course, with testing, it's very unlikely that you're always going to catch all of these infections, but now we see a systematic factor skewing it in a certain way, namely that, there will just be lots of people who are not reporting, whose infection isn't registered.
Right.
Yeah, so basically, you're less able to draw accurate conclusions, and then your decision-making also becomes a bit wobbly. And actually, for one of the domains in which this is quite serious right now is the tracking of variants in this country. So we know that so in India, there's been this new Indian variant.
We call it the Modi variant.
Do we?
Well, I like to name the variants after the
fantastic.
the far-right governments that bred them.
All right.
The Johnson variant, Bolsonaro variant, and Modi.
I think this is
a Trump variant.
So with this Indian Modi variant, if we choose, so there is some indication, or at least some suspicion, that it's more infectious than the Kent/Johnson variant, and that was already more infectious than the original strain. So we've seen the infection numbers in India go way up. In the UK, whereas the overall infection numbers are going down, the infection numbers with the India variant under the radar are going up drastically. Right. In the Netherlands, there's some suspicion, indication that something similar is going on, but we don't sequence nearly as much as the UK does. So I think in the UK, they sequence about 50% of all positive tests. I think here it's maybe 5. I have no idea. It's really low. Right. So this Indian variant might be spreading under the radar in this country. It might not be, which would be a good thing. But because we don't sequence, we don't have the data on it. Because we don't have the data, we can't make decisions.
Right.
So
And I think the assumption too is that as the vaccination numbers go up, supposedly there's going to be less spread. But of course, as you say, I mean, the vaccination is already quite high in the UK, so that wouldn't necessarily be the case. And also, the population that's being vaccinated here is still older. Like I got my first shot last week.
Wonderful.
But I know that, for instance, there are many people in their 20s, younger, and even in their 30s, that are not going to get vaccinated until mid to late summer. Yeah. So, and those are the populations least likely to have symptomatic illness. At least with the wild type variant, I think we might see some cases with if the Indian one becomes dominant. But it seems like that could be a hidden kind of wave. Yeah. If it's just if older people are vaccinated, then it could be a hidden wave that's sort of moving through society.
Yeah. So we have a large portion of the population now who has had no vaccine at all. Yeah. And then for those who have been vaccinated, I think the latest I read was for the Pfizer and the Oxford AstraZeneca. So if you've had 2 shots of the vaccine, then Kent, UK, Boris variant, it was way up in the 80-90% protection. Yeah. With the Indian variant, it already dropped. So the protection there was much lower for both of them. If you only had 1 shot, then it's still lower. So large portion of the population not vaccinated at all. And then even if you're vaccinated, then the India variant seems to have some sort of resistance towards the vaccinations currently given to the population. Yeah,
they're definitely seeing breakthrough infections in people perfectly vaccinated. There was at least one case, I think in Gelderland, in a Dutch care home, where over a dozen fully vaccinated seniors got sick, and one of them died. And in the news coverage about this, they speculated that it was a care worker who was probably infected, maybe someone who had refused vaccination. So and I've also seen this reported a little bit with some of the other breakthrough infections that led to death. They always emphasize that the person who died was frail or old, which is what they did during the very first wave of this, was to minimize and say, well, you don't have to worry about it, because so far the only people who have died are people who are already quite frail.
Yeah, and this is, I mean, if we come back to the exclusionary and like discriminatory mindset, well, so what? A person was older or frail, whatever. We don't want these people to die. So everyone should be protected. It's not that would make it somehow acceptable.
Yeah. There is a real eugenicist streak in this herd immunity approach.
Absolutely, yeah. And I think, this is something that I would say, if there is going to be any further parliamentary scrutiny or investigation in this, that should be definitely looked into. I have one foot in the Netherlands and one foot in Sweden. Also in the Swedish government, they've been doing this ideal of herd immunity.
Yeah.
And the moment I heard that they were pursuing that, I had already read so many papers about what this virus was, how it spreads, and what likely was going to be dangerous or not, that I thought, okay, we need to take this very, very seriously, and we need to sit down and try to, first of all, stop it from coming here, and then contain it. And people in my environment were of the same mindset. And then we heard, we're just going to let it spread. There's serious questions to be answered there about who made what decision at what time.
It's important to note, because we're recording this now, and of course it'll post sometime later. As we're recording this today, the UK is going through a massive public reckoning over its herd immunity policy. The media is talking about what a travesty this was, and heads are going to roll. And meanwhile, the UK backed away largely from the policy shortly after they announced it. Whereas Sweden was quite bold and open about what it was doing. The Netherlands was sort of in between. It was like said, well, this isn't really the goal. It's a consequence of a controlled spread or maximum control policy. So.
Yeah, here you really see that they chose the sweetest words they could possibly choose, but that doesn't make it okay. And in my experience, we still haven't had a firm commitment from the government to say, okay, this is really bad, we need to stop this epidemic in this country. They haven't, as far as I'm aware, at any point committed to saying we need to work towards zero infection. I mean, we did it for all kinds of infectious, like we don't want measles to spread. We don't want all kinds of other infectious diseases to spread. We've done it for many of those. So, yeah.
Well, I mean, I think Sylvana Simons and Bayern brought a vote of this in Parliament, said, let's stop doing this. And it was voted down by a huge margin, party lines.
Yeah. So. Yeah, but here you really see that it took a whole new party to enter Parliament before one person before this first was raised as an issue. But that's the sort of holding to account that we haven't really seen in the previous cabinet in 2020, where there seemed to be something of a mindset of we need to support what the government is doing rather than holding to account. And I think that's very crucial that happens now, either from people in Parliament or from people like investigative journalism. We can use, like even the newspapers in the beginning had something of a spirit that they shouldn't contradict official government instructions. And that's, as far as I'm aware, wasn't usually the task of newspapers to spread government spread the line of the government. It's to investigate the truth and to spread the truth.
Yeah. It didn't just happen in media, it happened in other areas, of course. Dutch medical ethicists came out and said we shouldn't discuss Code Black, right? The ethics of Code Black, because, these are exceptional times. It's like people were basically abdicating their own role. I think was it the editor of Volkskrant who said, "Will not publish anything critical of the government."
It's really curious. It's really curious. And so I also read a lot of English language newspapers, and I haven't seen that mindset in that way at all. So it seems to be somehow they got it into their mind that their role is to spread the government line. Yeah.
There's a real lack of adversarial press or pushback from people who would otherwise that would be their role. Yeah. Can I ask you about the other piece that is on your Medium blog? Because I shared this with folks on my Twitter, and there was quite some interest in your piece. Could you talk a little bit about your essay on possible data fabrication, alleged data fabrication at?
We always have to say this, it's suspicious.
And how did you come upon this, and what is your main argument?
So this is actually, it links to what we were just talking about, the role of investigative journalism. So I came across this point by reading a piece by the journalist Marcia Nieuwenhuis, and they had written an article in the Algemeen Dagblad, just reporting on how things were going with the contact tracing in the Netherlands, and they'd done months of investigation in that. And for me, one tiny bit in that story stood out, where they said that people active in the contact tracing were, when they had difficult cases where it took a lot of effort to trace who got infected where, they were encouraged to write down that most likely the person had been infected at home. And in the piece, in that article, it was just noted that this had happened. But because I come from a history of science background, for me it stood out is that if you say that you have to record something, this data point of where did the infection take place, and you actually have no indication that that's actually real, then that's fabrication of data. So people were instructed to record that infections had happened at home, even when they didn't have any indication that people were actually infected at home. And so we don't know at what scale this is happening, but if that's a practice, then it means that you're in the data that you put out for contact tracing, the category of home is going to be way larger than you actually have evidence for. So then it comes to look like loads of infections happened at home, even though you have no clue where actually they happened. And that's potentially quite dangerous if, first of all, it's not good for official bookkeeping, because you shouldn't make up data. But it's also quite dangerous if you're going to base some conclusions on that. That's actually what happened. So what we saw when there was an initial release of these contact tracing data, people said, hey, look, this category of infections at home is so large in proportion to the infections where we know where they happened. It looks like most infections happen at home. The most was never justified there. And this mantra got repeated, most infections happen at home. But if you think about it, obviously that's not very credible, because they have to be brought into the home in the first place. It's not that someone is sitting on their couch and then suddenly this infection spontaneously springs into air.
I do remember when that was happening last summer, when the government kept reporting that most infections in the home, and I would start kind of sarcastically reply on Twitter weird, how did it get in the home?
Exactly.
But I think the thing that was important there, at least, was that at the same time, of course, a lot of commercial enterprises had been closed during the spring.
Yeah.
And then in the summer, there was a push to say, support businesses by going to restaurants, bars, cafes, and things like that. And Rita was actually saying, gather in bars because it's safer in bars than it is at home, which just seemed like an extraordinary claim, because the couple times that I set my foot anywhere near a bar, no one was following any kind of rules. And
absolutely.
No,
it really started to lead a life of its own, that people say, well, it's safer to go to a bar than to stay at home. Well, let's go to the bar because it's not safe at home, which is quite extraordinary. And also, this links back into the thing we started with the Fieldlab, because one of the starting points in the justification of holding these large-scale events is that they say, well, we can organize an event which is safer than staying at home. So if people come to our events, then they're safer than if they had stayed at home, because most infections happen at home. Yeah. So that's where the small data point of like saying that an infection occurred at home rather than saying just, I don't know, we don't know.
As an experienced shut-in, I can say that nothing is safer than staying at home.
Yes, I mean, you're talking to someone who's been in isolation since March last year.
Unless your home is literally on fire, it's always safer than public life in the Netherlands during a pandemic, I've decided. Let me just follow a little bit down this point. Sure. Okay, so another thing that came up about this most infections are in the home thing is what they really meant, or what they were really trying to communicate, was that there was too much mixing of households. Yeah. Right. So it's like, of course, you can't really help getting infected by a housemate or roommate or someone that you are kind of you can't avoid, right? But what they really meant was having dinner parties and house parties was feeding infections.
Yeah. And that would have been so easy to communicate. Yeah. Just say that rather than this fabrication.
Why do you think they chose to kind of default to home, if that's in fact what they did?
So I'm normally quite keen to say, there must be a further reason. I think at this point it's poor communication. Yeah. So I think they had, from the contact tracing data, I mean, home was never the largest category. It never, at least in the period I looked at, it never went over 50%. But most of the cases that they could trace to home. And then that just became sort of placeholder category of, be careful around this situation.
They were the easiest to trace.
Yeah, I think, yes, definitely. It would have been way more accurate to just say, don't. Well, I mean, it was already the official guidelines not to meet up with. They've changed so many times, but at least over much of the winter, it was don't meet up with more than 2 people from a different household. Yeah, I think, and that would have been sufficient to stop large-scale dinner parties. I do believe that they said, like, don't hold parties at home, but don't hold these dinner parties. But I think the communication has been less than optimal in the entirety of this pandemic.
So you said home wasn't the biggest category. What were the ones that impressed you, that were the most common sites where people got infected?
I haven't looked at it for the last couple of weeks, but when I looked at it, the largest portion was just unknown. Yes. So I looked at the early weeks and then a couple of months after that, and there it ranged between 55 to 75% was just unknown. So that was the largest category. So they just hadn't been able to trace where the person got infected. And then of the 25 to 40% where it was known, there it is the case that home was often the largest category. But how much of that was fabricated? Yeah, we don't know. And for the weeks that I looked at, it was never most in an absolute sense. Most was always unknown.
Well, that suggests that the contact tracing in the Netherlands is underfunded and unsophisticated, right? Because there are other countries that have quite extensive contact tracing.
Absolutely.
And there they see that there are quite some common places where people are infected, including, in offices, and in fact, in restaurants and bars.
But here it also plays into the point of what people will know about where they got infected, because if it's just left up to the individual, you know it presumably when your housemate is infected and that you got the infection from there, so then you'll be able to report it. If someone you chatted with in a bar, you might even not know their name. If they were infected, then if you have to look back in a 2-week period, which encounters did you have, that might not be the thing that springs to mind. So individuals might not recall this or be able to report it.
Yeah.
But what you say about the funding, that's definitely true. And that's also something that came up in this article by Marcia Nieuwenhuis, that they just spoke to people who were in charge of contact tracing, and they said, this has been, like, the cuts have been going on for decades, so we're just not equipped to devote more to this than we currently are.
Right, and there were a couple of anecdotes that really stuck out there. For instance, weddings. Could you talk about when they encountered things like weddings, they would just write them off as home infections?
Yeah. What I recall from what was mentioned there is that it would be too cumbersome. Like, that would be a quite complex case if you have a wedding with, 50 or 100 people. A lot of work to trace all of these people and then their contacts. So then if you can say, well, this person, sure, they went to a wedding, but it's most likely at home for whatever reason, then you can close that file and move on to the next. And otherwise it's way more work.
One of the reasons this is interesting to me, of course, is that right now in Amsterdam this weekend, there's going to be a demonstration by the cultural sector. And one of the claims demanding to reopen, museums, nightclubs, cinemas, and things like that. And one of the claims that they're making is that there have been no outbreaks in cultural venues. And I know for a fact that that's not true, but I also know that if contact tracing excludes you systematically, then of course there's not going to be any data. Similarly, I was teaching in university this past year, and we were, and some of the instruction was hybrid instruction, so they had teachers going into a classroom with students and limited class sizes, without masks, and the university would report the infections that they knew about, or at least that was the premise, is that they were going to tell us how many students and staff had been infected. And it came up, well, are you going to tell us if someone in our class or office was infected? And this was a quite curious answer, which I then realized is part of this whole system, is that because on campus we have a rule that you have to sit 1.5 meters away from someone, that rule is the protection. So you are not considered a close contact. So even if you spent 3 hours in lecture, because the seating plan would have you far enough away from each other, the GGD would not consider you a close contact. And then the university arranged a Q&A with someone from the GGD, and they repeated this. So
that's just dreadful. Because we've known about aerosol transmission. I mean, it's only been officially established officially mentioned by the WHO quite recently, but this has been known for months. So then to just discount that,
there have been a lot of hints too about the contradictions in this. So for instance, I was a user of the app, the notorious the notorious app that Corona Melder that tells you someone that you've been in contact with has tested positive. And one of the things that was on the government's website about that app was, well, you might get a false alarm if you went to a movie theater, because that you would have sat for more than 15 minutes near someone. And I thought, well, isn't that maybe a sign that being unmasked in a movie theater is not, if you get a false alert? Similarly, when school children were having that app activated, when they go to school, they have to surrender their phones so they're not putting on them. And they told students to disable the app because having their phones together in the same bucket or whatever would set off, which makes sense, but it's also kind of darkly hilarious that, that should be a sign actually that gathering together in school is a high risk activity.
Absolutely.
They said, no, it's just a sign that the phones are sitting next to each other.
Yeah, absolutely. I mean, I've heard similar things about people working in nursing who have to put their phone in their locker at the beginning. Yeah, I think it's very good that they had something like that. But they also, as far as I understand, built in this artificial 15-minute time threshold that if you'd spend more than that time in the vicinity of someone who was infected, then you would get the alert. But if someone with COVID sneezes in your face, it can be a matter of seconds. Tricky that. And
certainly they already have research that shows people getting infected in less than 15 minutes.
Yeah,
especially indoors. Regardless of contact. But I think now, at least in the Netherlands, it's kind of assumed that if you're at least 1.5 meters away from someone, it doesn't matter. You'll never get infected, right? There's just sort of this idea that distance is what keeps us safe. The RIVM tweeted out footage of a news interview that they were doing. And the TV correspondent was walking around their office and nobody was wearing a mask. And somebody tweeted at RIVM, why isn't anyone wearing masks? They said, well, we keep the distance. We wash our hands. And this was an extraordinary claim, masking only applies to public buildings and we are not a public building.
Oh,
this is also
it's quite drastic. It's quite drastic.
Yeah.
Because this whole mantra of staying so many meters apart. Yeah, of course you've got to stay so many meters apart, but given that we know about aerosol transmission, that just doesn't work if you're sitting in the same space for hours on end. Yeah, so there's again thing about communication.
There's also a redefinition of what counts as public, right? So the University of Amsterdam made a similar claim. They said they didn't have to require masks because they were not a public space.
People have been very flexible with finding these convenient definitions.
I was wondering, could you talk a little bit about your own research background and how you came to write about and scrutinize the corona?
Yeah, sure. So my own background and training is in history of science and philosophy. And normally I just hang out like a couple of centuries ago with only dead people. And that's the material I study. There I do look at questions about how in certain scientific communities people use data and information. So this topic about information use, information sharing was something I had looked at before. So as I mentioned, I'm currently based at Uppsala University in Sweden. And there we're doing a large project around vulnerability. So it's called Engaging Vulnerability. So that's with, like people doing history, but also film studies, literature, like a whole mixed group. And I'm the one looking at vulnerability and information and data. So for me, it was already a bit of a theme of, hey, how can people be vulnerable if they share information which might not be reliable, or if they share too much, or precisely if they do not share and hoard information and they keep data that should be disclosed, they keep it secret. So that was already a bit of a theme for me. but I hadn't been looking at it in contemporary circumstances. I'd just been following what was going on with the coronavirus epidemic in the Netherlands, from a personal capacity. But it was really around January that I was talking to friends about what was going on with the field labs. That I thought, hey, how can this be research if it's just this group from the event sector? And that got me sort of interested in that. And then I thought, okay, it's taken me so many hours figuring out who this field lab group is and what they're doing and how they've operated. I might just well write it up. Maybe it's useful for other people. And it was actually similar with the thing about what I mentioned about data fabrication and the contact tracing or potential data fabrication. I read this article by this investigative journalist, and then I thought, what's going on here? And I thought, well, let's just share from my background what I can say about where it's actually quite risky to rely on fabricated data or manipulated research, and what the consequences of that can be, and then maybe other people might find it useful.
Right. What are what are the consequences of the data being bad, for instance, on contact tracing in the Netherlands? What consequences could it have for the future?
Actually, so some of the things that some of the dangerous consequences that we've already slightly touched on. So if your category is of the number of infections that takes place or the proportion of infections that takes place at home is inflated, like it's basically larger than it should be on the basis of what you know. And then if you start then recommending people, well, just go out, whatever you do, don't stay at home, that can lead to more infections. And if these large-scale events, field lab, for example, are permitted because it's safer to go there than to stay at home, that's you're giving people the wrong sort of recommendations, and you're not being open about what's actually going on. So wrong policy can follow from that. And then with the lobbying from field lab events, I think what's going on there is it would almost be too much to say that they're putting out data or results, because it's mostly they do write up what they did, but it's not that we're not getting the actual records. We're not getting any official analysis. Most of what they put out is just press releases saying all of this went well. There were hardly any infections.
Right.
So it's not even really results. But the risk there is because these press releases that they put out, they have the label of, hey, this is science, this is research. It gets this credibility and people take it seriously. And then people think, well, they've researched it. It was sponsored by the government. So surely this should be all right. Whereas we've seen with the tobacco industry, we've seen with climate change deniers, actually, even if it carries this label research, maybe we should be really suspicious if there's a lobby group behind it. And again, it can have quite risky policy. Policy can be based on this. So that's in the future something that we might be cautious about. Keep an eye on how this is going to be used. This basically lobby work.
Speaking of the future, are you planning to do more research or writing about this topic?
Well, I think I'm definitely staying in the domain of the data and information vulnerability. I think I'll proceed in a similar way as these two pieces were born, just seeing if I find something, hey, I might be able to contribute something here and this requires our attention, then it might get a write-up.
Now, I know you're living in the Netherlands now, but you're based out of Uppsala University.
Yeah. It's been all virtual this year.
Have you been scrutinizing Swedish policy? And what kind of similarities and differences do you find there?
Yeah, I joke to my colleagues that not been able to go to one country which is extremely lax with its regulation, and I've been stuck in another country which is also extremely lax in the regulation. What I recall in the beginning of the pandemic is that everyone looked with admiration to Sweden, and they were saying how wonderful it is that you can basically not take any measures, just tell people to stay cautious, and it still works.
Yeah.
Like there were fewer infections in Sweden. It's also a much smaller country. At that point in the Netherlands, the rules were also quite lax, but we've been strict. Like in Sweden, they haven't had a general lockdown or a curfew like we had here.
Yeah.
But now you see that in terms of infections per head of the population, Sweden is doing much worse than in this country. So I think they've got a similar number. We have 17 million people, a bit more. They have around 10 million people in the population, but we've been keeping up in deaths. And actually, Sweden and the Netherlands are doing in Europe. We're in the top two of worst performing.
Yeah, although I think that both countries will point to the per capita death rates in places like Italy and Belgium and Spain, say, well, look, in the final tally, fewer as a percentage died. That, of course, doesn't take into account all the long COVID cases that are already emerging in both countries.
Which is a very serious issue, and I think that is not talked about enough in this country.
Yeah.
But I mean, slightly an aside, but the death figures was also an issue which has been called out recently. So officially, that there was also some misrepresentation of the figures going on. So officially, according to the RIVM, we have over 17,000 deaths. But then the Central Statistics Bureau, CBS, records, I think, around 24,000 deaths.
Yeah.
And then a couple of weeks ago, there was a study by the Institute for Health Metrics and Evaluation at the University of Washington.
Yeah.
And they calculated for the Netherlands over 30,000 deaths. So that's, well, it's not exactly double, but double the official figure, but that's quite a large proportion of deaths not being registered as such in this country.
Maybe just one last question. We've gone a little bit long. Personally, what has been the biggest change that you had to make in your life over this period?
Well, I'd never been in self-isolation for months on end. So for me, that was just a massive shift. And and all of my... So I started at Uppsala in September. All of that work has also been virtual. So I'd never been in so many Zoom meetings in my life. That's been a big shift. But it's been manageable. I just would wish that people designing these policies would say, okay, now it's been enough, and now we're really going to crush this epidemic here. So that we can actually go out again. And
Do you anticipate going to Uppsala in the fall?
Well, what I said is if I've been vaccinated and fully vaccinated, and there's not this huge risk through community transmission, then I'd be there today. Then I'd be there tonight. But as long as it's still so risky, it's just not an option for me to go out. So then we'll have to wait and do everything virtually.
And hopefully your students or colleagues and everyone else would have access. I don't know. Are you also a teacher?
I'm going to be teaching, but at the moment I count on that being a Zoom course or just virtual course. Yeah. I mean, you can do loads of teaching. Like teaching can be. I've heard very positive responses from students about. I don't know what your experience has been there.
I have to say, I think I had another guest here from the UFA a couple weeks ago,
Yeah.
Polly Pallister-Wilkins, and she said, look, even if Zoom teaching wasn't ideal, we can do it. It's available to us. And that's really the issue, is that if we want to protect the most vulnerable people in
Yeah.
the university community, which is not just the teachers and the students, but also support staff,
Yeah, everyone.
people who drive the trains and the buses, then we should do this because we can. So I decided not to treat Zoom teaching as an ordeal, but rather, hey, here's your chance to go to school in pajamas. Although
absolutely, yeah. No, this has been my experience as well. If you think, this is what we used to do, and now we have to do it virtually, then it's going to be a disappointment. But if you just think, hey, here's a whole new format, how can we use it creatively? What can we do with it? Then it becomes really fun.
Yeah. I think that's a great positive note that I didn't expect to have today. So, Chris, I want to thank you very much for taking the time to talk.
Sure. Yeah, thank you for the conversation.
That concludes my conversation with Chris Meyns. The conversation was recorded on May 27th of 2021. If you would like to learn more about Chris Meyns' work, their website is Chris Meyns, that's ChrisMeyns.xyz. And that's where you can find their main website. And then if you want to read these two excellent pieces on data fabrication and on Fieldlabs, they're at chrismeyns.medium.com. And I really encourage you to read both of those pieces. I want to thank you very much for listening. And I want to thank again Chris Meyns for joining me for this conversation. You have been listening to Breaking the Waves, Conversations about the Dutch Pandemic.